to another lovely Monday. Monday is always so exuberant because I'm coming in front of you after 2 days of missing you all. So hope you all missed this as what we always miss you all. So welcome to another lovely week with me, Vinod James. Welcome to Neethus Academy, Reading Live. As I would always be coming in front of you from Monday to Friday without fail. We try to come every possible day, especially from Monday to Friday. The very same time, the very same page that you're watching, or the very same channel that you're watching. Uttam Kumar, good afternoon. It's always nice to read out your lovely names. You are also eagerly waiting, as we always know. So what are the things Neethus Academy has in store for you? Neethus Academy offers an array of linguistic exam training. So if you want to know more insights about it, please do not hesitate to contact the number which is already there on the screen, 974-7944-374. They will be happy to assist you. Any insight about what exams can you be of benefit, what are the exams available, what are the trainings that we offer, anything. Softy, good afternoon. 𝐿𝐶𝐬𝐧 career, good afternoon. And if you want to know what are the batches that we have, as I've mentioned, we have regular batches as well as crash courses available. So you want to know what suits you best, what are the criteria that is there in order to get enrolled in that, they'll be happy to assist you. Anuar, good afternoon. On top of that, Softy, thank you very much for asking how am I. I'm always doing good as long as my students are doing good, isn't it? What else could we ask for? Being a trainer, it is all how you feel about it. As long as you're there, eagerly waiting, couldn't ask for more. Thank you. Siminebu, good afternoon. Sobi, good morning. Lini Korean, good afternoon. Saumyana Thomas, good afternoon. Geethu Soni, good afternoon. So nice to see a lot of icon next to your name as well. So if you have not yet liked our page, please do like our page. If you have not yet subscribed to our channels, please do subscribe to our channel. If you have not yet followed our channel, please do follow. And a small thing from my side, if you have not yet shared the very same page link that you're watching, please do share in your social media platform, because the more you share, the more people get the access to it, because there are a number of students who are still unaware that we do give free classes. Reshmi Ji Raj, good afternoon. Geethu Soni, good afternoon. Sneha Ashish, good afternoon. Good, lot of profound names, like I've been repeating those names. So happy to see all those names again. Abhiya, good afternoon. How was your weekend? Tell me. Neethu Jose, good afternoon. Tell me, how was your weekend? Let me see. What all did you do? Very curious to know, because you're all so kind to ask, what did I do? How am I? And all those. So I would definitely want to know, what did you do this weekend? Okay, and of course, as you can see, our next batch is only available from Jan, Feb, March, and it's just going to close soon. Okay, that shows the trust our students have in us. Shakila Banu Saudi, good afternoon. Liji Thomas, good afternoon. Because our students trust us, and they think that we can be that bridge between them and their dream, and that's what we always want to be. Liji Thomas, good afternoon. And we've just pinned the channels that we have. We have 2 Telegram pages and 1 WhatsApp channel. We've just pinned. If you've not yet joined, please do join those, because those are all free access for you. Soumya Joseph, good afternoon. Josia Tom, good afternoon. With Muruga, good afternoon. Asha Bobby, good afternoon. So if you really aspire to have a professional training, do not hesitate. Go get those things done and dusted, because it's never a doubt that you have the potential, because you all have the potential. And as you can see, Neethu Madam is going to come 1st of December. 10 p.m. and the very same page that you're watching. Do clock in 10 p.m. Indian time. Kavita Balaji, good afternoon. Asha Shibu, good afternoon. 𝐿𝐶𝐬𝐧 career, studying, focusing to reach our dream destination. 𝐿𝐶𝐬𝐧, as long as that intent is there, mark my word, you will definitely be there in your dream country no sooner. Okay? Good enough. Keep on working. Your hard work would be rewarded for sure. Right. Anybody who's attending the live for the very first time, who's here for the very first time, Adhyamayitte live attendee. Now, why I keep on asking is because there are n number of students who share. Okay, so because they should know that their share is never gone wasted. Okay, because you're always there to make sure that I keep on asking is because students might feel, oh my God, am I sharing and they're not able to, no new students and all coming. No, there are n number of students who are coming, but they are reluctant to say that I am new as well. But don't worry. Anita Prabhu, good afternoon. Jyoti Janu, good afternoon. Leslie Scaria, thank you. Jesse Abraham, good afternoon. Jinsi Shibu, good afternoon, Jinsi. Right. Jaya Karthik, good afternoon. So I would definitely want to see at least one icon next to your name that shows that how much you love us and support us. Okay, there are n number of students who have many icons next to their names, but I would definitely request you to have at least one icon because whatever that we are doing for you, it's just to show that yes, you are enjoying and you are absolutely being benefited out of what we do. Okay, so if you have not yet liked our page, please do like our page. If you have not yet subscribed to our channel, please do subscribe to our channel. If you have not yet followed, please do follow. Mobby Jackson, good afternoon. Is there anybody Adhyamayitte live attendee in Naringrod? If so, please do let me know that you're attending for the first time and where you're from. I love to know where you're from. Not for any reason, okay? It's on the aspect of telling myself that I have people across the globe that I know. That's all. Okay, not for anything. Don't think that we're just going to ask you to say this for any other reason. Okay, so anybody attending? Josiah, thank you very much, Josiah. May I know where you are attending from, Josiah? Josiah Tom attending for the very first time. Excellent. So as I've mentioned, things doesn't, it's always students are there. Right. Shruti, Chris, Paul, good afternoon. Anujins, good afternoon. So I have Josiah Josiah Tom, don't know where, but of course, a new student there. So happy to see that there are n number of students. Even though there are few who have told, one who have told Josiah who said it was for the first time. Kale, good afternoon from Maldives. So you are attending an international class. See, I told you Maldives. We have students from different parts of United Arab Emirates. Andrews, good afternoon. Dia Thomas, good afternoon. We have people from different parts of Africa, Afghanistan, Pakistan, Sri Lanka, Malta, Maldives, Mauritius, of course, different parts of India, Nepal. We have people from Israel, New Zealand, Australia, UK, Ireland, Scotland, Italy, you name the countries, we have people all attending. So it's an international community that you're there. Anshu Roy, good afternoon. Excellent. Good. So I have one student who was there. I'm happy, isn't it? Thanks to all of you because you are all our patrons. Because of you, all these students are there, either by word of mouth or by your share. So it's all there. So if you can, please do share because there are a number of students who are still unaware that we are doing such kind of classes. And you can be that bridge between their dream. You can be that small part and they would always bless you for that. Suja Santosh, good afternoon. Right. So, yes, what are we going to do? We'll be talking about two things, a part A and a part B. So part A, which I've already shared, and part B would be there on the screen no sooner. Okay. So I think all the students are there. So are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for today's question. And how many of you say that I will get all the things right today? I want to see how many of you are there with that intent of getting all the answers right. Who are all here? telling that I will get everything right. So B is there. Okay, excellent, good enough. Soumya Joseph is there. Good, good, good. Simini is there. Okay, good enough, good enough. Kale is there. Good, good. Shakila Banu, yes, good enough. Softy always ready. Fair enough. Bit Muruga, ready. All right. Sneha is ready. All right. Neethu George. See, I love those students who have that, like they're saying, yes, I am here. Why? Because you need to speak out in public. I am there. That gives you a lot of positivity into you. Why? To be, like to be in front of everybody saying that I am. 𝐿𝐿𝐶𝐬 ready, Reshmi ready, 𝐿𝐿𝐶𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬𝐬 Ansu Roy ready. Excellent. Anu are ready. So as you all have said, not all, okay, there will be a day where all of you would start telling, see, I'm here with that purpose. What is my purpose? To make sure that I announce myself in front of everyone. I am here with that purpose of making my dream a reality. Good enough, as you all said that you're all ready. The question will be popping up on the screen, and do not waste the time. Do beat the time. Okay, you have a 2-minute clock there. But before that, you have to find an answer. Shine Johnson ready. Okay, good enough. Yes, there you have the question. Please do the material. Don't type the answer. Just once you're done, just put a thumbs up. Yeah. All right. Time I've just alluded. Yeah. Geetu Soni, the first one said done. Good enough. Shakila done. Good. How about others? Did you all get an answer? I'm sure that you did. Isn't it? You should never finish your time without an answer. Anu done. Softy Stephen done. Kalei done. Okay. Apia done. Okay. Good, good, good. Siminibu done. Jesse Abraham done. Ansu Roy done. Kavita Balaji done. Vibrin Shah done. Sobi done. Christina C. Okay, Christina is eagerly to tell me the answer. Babita Martis. B. New name. Christina Varghese. New name. Sheba Sargent. C. Soumya Joseph. D. C. That means you've not attended my live before. I would always ask you, tell me what is your answer and where you got that answer from. That where is very important for us. Hi Sumi. Sneha, C from last part. Okay, fair enough. Josiah Tom, B. Suja, B. I got B from second last line. Okay, fair enough. So I got B is from second last line, C from the last part. So Neethu is saying C. So it's a mix of C and B. Shakila Banu, B from the last part. Okay. C from last part, B from last part. Fair enough. A B from last part. Okay, good enough. So Anwar B, Ansu Roy B, Anita Prabhu C. So C also from last part, B also. This is where that trick happens, isn't it? In part B. The same place, you get both the answers. Depend on how you read. That's why reading comprehension is very, very, very important. Softy B from last part, Jesse Abraham C from second last line, so B C from last part. I want all of you to comment. Do not worry. Even if you have got any other answers also, be happy to comment. Okay. Kalai C from last line. Sumi. Now pass. Thank you for your guidance. Sumi, thank you very much for giving such a lovely news. Would you be kind enough to tell me what are your scores? And it's of course your hard work and along with God's grace. You can be that significant factor, that bridge between you and your dream. It's all your hard work. So happy, Sumi, for you. Okay, please be kind enough to tell me what are your scores so that it motivates all the other students in front of me. Shine Johnson C, Rasna B, there Kalai is telling congratulations, Shiba C, Softy saying congrats, Kavita Balaji C, Krina Patel C, last two lines, Jyoti Janu B, Shakila Banu saying congrats, good enough, Siminibu, congratulations. So Sumit, all these happiness have been shared that you have taken the, the biggest move to come and tell in a public platform saying that you have made it to your dream. All of us are happy, as us all, because we always believe it's all a family that you all know. Anita Prabhu, congrats. So take all these congratulations from all of us. And I only have prayers for you. That's the only thing that I can give you. So happy for your great achievement. Geetu Soni saying A, bless his career C. Good. So all those answers are there. Asha Shibu C from the last two sentences. Asha Shibu, congratulations. Take all these lovely, because you're all happy for all of us. Excellent. So now let's go and answer Roy. Congrats. Take. This is all for you. So let's go and see how to deal with part B. Uttam Kumar C from middle and last. Okay, fair enough. Krina Patel, congratulations. Good enough. Sumi, 3B, 1C, first attempt only because of Neethu family and blessing from God. Thank you very much, Sumi, for your hard work. You're giving us also that smallest gesture. Fair enough. Would you be kind enough to tell me what is your reading score? Let's see how, just the score so that it motivates all the other students. Yeah, if you could, it's not mandatory. Right, now let's go back and see what are we here for. So the question is there. So the first and foremost important thing when you're doing a part B is read the question, understand the question, and you're expected to read along with the question. Especially these kind of questions if it's not a WH question. Okay. So what is this? SGB is known. Now see the difference, okay? You can't separate it like that. You have to read along with it. So SGB is known to be more effective. That's how you read. Okay. SGB is known to provide temporary relief. 380 readings for me. Absolutely very, very good. Keep it up. So it's a stunning score. Very, very good. So proud of you. So me keep it up. So SGB is known to be proven. Now that to be proven is very important word. Okay. Please look into it. Now, after underlining the keywords, now you're going to go read the paragraph. Kalei, wow, fair enough, Kalei. One day you will also come and tell me the scores. No worries. So, stellate ganglion blocks, SGB. So, abbreviations there. So, stellate ganglion blocks are the most commonly performed interventional procedure for patients with upper extremity of CRPS. Now, CRPS, what is that? So, it is complex regional pain syndrome. Okay, now what is the strategy for part B? Elimination method is the most appropriate strategy. So in order to eliminate, don't search to eliminate. As you read, eliminate the answer option and go. Now they have given an intro about what is SGB. Now stellate ganglion is located in the anterior of the 7th cervical transverse process on the anterior surface of longus colli muscle. Now they're giving, okay, this is where it is. It lies medial. I wish all your words come true. Do not worry, my words will always come true. All right. So it lies medial to the vertebral artery and anterior lateral to the ipsilaterals. Now this ipsilateral. Anybody know what is ipsilateral? On the same side, okay? So I know that you know, but still, that is a new word for me. So I always search. So I wanted to make sure that you are also told and you have been, if at all you would have forgotten, if not, just to refresh. That's all. Okay, so ipsilateral common catoid artery. This ganglion can be accessed either through fluoroscopy, CT, or ultrasound guidance. In a study published in 2006 by Ackerman and Zhang, 25 subjects underwent SGB at weekly intervals for 3 weeks. And at 6 months, 40% of people had complete symptom relief, while 24% patient had no pain relief. So it's not that all the people had a relief or they had. So in a second study, now 2026, 24, then they are saying in 2009, 3 weeks blockade were completed at intervals of 22 patients. CRPS type 1 on the hand. So it is one specific one, okay? Pain intensity and ROM. It is, of course, ROM means, you know, what is ROM? Whereas this 2 weeks after treatment. So what happened? The patient had statistically significant improvement in wrist ROM and an overall decrease in VAS value 8 to 1. While most physicians do not believe that SGB alone is effective in curing the disease, we do know that SGB at least offer temporary benefits that last well beyond the effect of local anesthetics. Okay, so what are they saying? Now, A, to be more effective in treatment, is it SGB is not to be more effective? That's a straight eliminator because not mentioned. Okay, now to provide temporary relief. Throughout it is talking about why 24% had relief, but there is no relief. Then they are saying at this significant improvement is there and an overall. And while most physicians do not believe that SGB alone is an effective curing disease, we do know that SGB at least offer temporary benefit. So it is pointing into B. Now, that is the only thing which is the answer. Okay, so congratulations for people who have got B as an answer. Now, why C is not? You haven't read. I told you read along with that. So SGB is known to be proven. It's already proven, isn't it? To be proven means it's a futuristic term. Understood? So, not there. To be proven, they have already proven, saying that it is instant. In certain instant, it is effective. To be proven, no. It is already, they have given you 2 studies also, isn't it? So, to be proven, that word changed. Understood why your answer is B? Because that to be proven changed the whole concept. Simini was dancing, Jyoti Jan was dancing, Abhiya is happy. Why not? Isn't it? When you make something right, do cherish. Soft Stephen is happy. Good enough. Rasna Suraj is dancing. Good, good, good. Enjoy your achievement. That's how we grow. Every small achievement, you should make it as if it is a huge achievement. That makes your thing more positive. Okay. Like what Sumi have said, it's a motivating thing on the aspect. See, cherish your smaller achievement and then come with a bang and say, I made to the dream. Just picturize that one day I'll come and say, I made it to my dream. That should be the focus, and that should be the intent. Whenever you're doing a material, your intent should be, if I'm going wrong, no problem, I'm here to get it corrected. I'm having an open approach to say, okay, I got it corrected, so that I will not do the very same mistake again. Kavita Balaji, happy. Any doubts with the thing that I've just told you? Anything that you're not sure about? Anything that you want me to clarify? Anything like that? Any doubts? No doubts. Very good. You're all lovely students. Why? You're all there, having an open approach, saying that I'm here, open. If I'm corrected, no problem. I can make myself corrected. That should be the spirit, and that is what I love about each one of you. So good enough, because you don't have any doubts. Are you all ready for the next one? Yes, shall we go to the next one? What is the next one? As you always know, what is your part A? How you felt about today's part A? That how is important. Optical nerve stimulation, a little bit tricky. Okay, fair enough. The first one is tricky. Shakila is saying easy. Fair enough. How about others? ONS. Easy, tricky. How about others? How did you feel about it? I want all of you to comment on the aspect of how you felt about today's material. Clear? Because you have to tell what you feel. It doesn't matter what others feel. You, what and how it feels to you. Leslie is saying bit tricky. All right. How about others? Kalei, it was tough for me. Fair enough. Fair enough in the sense, I just love the attitude. Okay, see, you have to say what you feel. A little bit tricky. So generally, it is giving a weightage on the aspect of it's a bit challenging. Is that? All right. Fair enough. Sneha also saying tricky. A little tricky, Sumi. Sorry, Simi. Neethus is also saying tricky. So basically, it's a bit challenging, is it? Right, even though I don't have the majority of the people who are commenting. Kavita Balaji, little tricky. Albin. Sony Raphael, okay. Tough, little bit, okay, fair enough. Tricky material answer. So mostly it is tricky, is it? Excellent. Now let's see. Are you all ready with your answers with the pencil? Tick, tick, tick. Are you all ready? Yes, give me some thumbs up. Let me see how many were ready with your answers. Eagerly waiting for the answers. Anybody? Anybody? Nobody? Yes? I'm sure that you all are ready. There. Soumya is ready. Softy is ready. Simi is ready. Neethu Soni is ready. Excellent. Anisha Sam is ready. Abhiya is ready. 𝗏𝐿𝐿𝐴 is ready. All right. Asha Sibu is ready. With Muruga is ready. Jesse is ready. Okay. Because you're all ready. Now you'll have the material. Hina Rose is ready. Hina Joe, sorry. At times the name just pops up from my profound memory because all my students. Shiny V is ready. Rosmi George, good afternoon. Tricky material. Okay, Rosmi. Thank you very much for that. Right. Now what are the things that you have to be very cautious about? Okay, this is the first material that comes in your way. Anita Prabhu ready. So you will only have 15 minutes to do this, and you will have to tackle 20 questions. So without a proper strategy, you will not be able to complete it. Okay, so what is the purpose behind part A? The purpose behind part A is, are you able to locate specific information in quick time? You have to be very quick. And please understand, you don't have to understand the whole meaning about each and every word. And Tina George, good evening. So you have to have a right strategy. So what is a strategy called? Strategy is called as skimming and scanning. Skimming, quick look, scanning, detail look. You know what is scanning. Okay, so when you find that area where you have referred the keyword, there you're going to scan. That's the difference. Okay, don't read word by word and all. You will have 4 texts. Each text will be different to each other, which will be based on one common theme. In this case, the common theme is occipital nerve stimulation. So ONS. Now, what are you to do when you are skimming? You are to underline the keywords. Now, what are these keywords? Keywords are words that you find something which is unique. There are a lot of things. It can be a proper noun, new word, number, bulleted form, abbreviation, letters given in bold letters, italic, heading, subheading. So these are things, and if you are not aware of it, we have done an exclusive video on the very same page that you're watching. It dates back. Do go back here. It will give you a lot of new insights about it. So please do. Smita Joby, good afternoon. Now, what are the things that you want to underline? So I'm just going to show you. Occipital nerve stimulation is a neuromodulation technique used for the treatment of refractory primary and secondary headache. So clearly, primary, secondary headache. ONS is also indicated without the underlying organic secondary caused by underlying condition, neck injury, infection, severe high blood pressure, intractable headache. So disorders including migraine, non-migraine use, chronic headaches, neuropathic pain, occipital region. Chronic headache is commonly defined as a headache which is of 15 or more days and say even every month for longer than 3 months. Patient with refractory headache fail to receive conventional drugs. So either because they lack the effect, intolerable side effects, and contraindication of using oral was first used to treat headaches in 1977, but it's considered as a treatment in the development. I'm done. Now I know there are a few things. Okay, what are the causative factors? How long it stays? When it started treating, and all those things in A. Likewise, in most a trial case test led to the placement of performed in order to succeed. So this is talking about a test, permanent lid placement. Now a study, definitely between 2005 to 2009. So that is there. Then procedure related complication. So complication, any complication which is related to the procedure go. So here it is saying hardware related, biological complication, and some other complication. After this, you're going to go to the question. Okay, so here you have to understand 20 questions are divided into 3 types of questions. 1 to 7, these type of questions are called match the following question, where the instruction clearly says it should be either A, B, C, or D, and you may use any of these letters more than once. So it's definitely those 4 letters you have to type, and of course you can use it a number of times. Now, underlining keywords are very important because part A is purely keyword reference, not about understanding or comprehending the meaning. So how many patients, so definitely how many should be there in the study with chronic refractory CH. So where C, is it saying anything about chronic refractory CH and all? Number of patients, 15 with refractory chronic CH. A very straight answer. I told you, this is how you refer with the keyword. What are the drawbacks of conventional drugs in refractory headache? So conventional drugs, where are they talking about conventional drugs? Is there anything which is mentioned in conventional drug? See, the conventional drug is there. What are the problem? Because lack of effect, intolerable side effect, or contraindication. So the answer is A. Understood how keywords are to be referred? Now, how to avert lead migration complication? So avert means prevent. So lead migration, where are they talking? They're talking about, it is there, isn't it? Indeed. Smita Joby again. Wow. I got the result. Thank you so much for your guidance support. It was my difficult task and your classes really helped me to achieve. So Smita Joby, congratulations for your effort also. Would you be kind enough to tell me what are your scores again? So another lovely motivation thing, or sorry, motivating thing for all my lovely students. So 2 people have made it to their dream. Absolutely good enough. Sumi and Smita. Excellent. So proud of you all. Yeah, good enough. And once again, thank you for coming in, giving that catalyst. You're all catalysts because the other students also say, okay, I'll also say this one day. Good enough. So the answer is D, a very straight answer. Understood how it is? You have to always remember. Now, when was Smita Joby? Thank you, Smita. Thank you for getting that great thing on your life and also to come and tell such a big thing that has happened in your life to us also. And see, all our family members are happy for your great achievement. So take all those congratulations to you, Smita. This is all for you as well. So when was ONS first employed? So do you really need a second thought? Because it clearly says it was in 1977, isn't it? So straight answer, hey, Anshu, congrats. Fair enough, fair enough. So what additional complications comes with ONS? So additional complication itself is there in D. Understood why keywords? Now, is there anywhere additional complication is mentioned? So it is there. Let's see. Some other complication, the ineffectiveness and all those things are mentioned. And on top of that, include use of silicon glue and all those things are mentioned as such. So be aware of such kind of keywords. Good enough. What is the duration for completing midterm follow-up? So duration, definitely from the study. Midterm follow-up means 36 months. Do you really need another thing? No, see, straight. Understood? So why is a trial-led placement essential? So why a trial-led? So definitely trial-led where? In the cases of, so it clearly says, so in most cases, a trial test-led placement is performed in order to assess whether the simulation will work as expected. So that is the reason. So the answer is B. So I have wrapped my 1 to 7. It's high time that you start telling me what are your total. In the meantime, let's go to the next set of questions. These set of questions are called short answer question, where the question numbers are from 8 to 14, where your instruction clearly says the answer can be as simple as that of a word, number or numbers, or both, or a short phrase. Short phrase should be anything between 2 to 3. That's the maximum. Okay, just keep it like that. 𝐵𝐶, Soumya 7, Ansu 7. Excellent, good enough, good enough. Softy 7, very, very good. Anju 7, Anju Sachin, new name. Okay, Shine. Okay, now next question. Drugs that are employed to address infection complication post ONS. Kavita 7, Abhiya 7, excellent, very good. So drugs post, where are they talking about post? Hina 7, very good. So drugs is all mentioned in text D. So complication is there. Geetu Soni, Anisha Sam. So what are they talking about all those drugs? So prophylactic antibiotics maintaining asepsis throughout the procedure, trimming of occipital region hair using clippers. So the answer is, what is the answer? Prophylactic antibiotics. So drugs are asked. So PROPHYLACTICANTIBIOTICS. Excellent. So what is guided fluoroscopically towards the greater and lesser occipital nerve location? So something has been guided through. What is it guided? So definitely through the surgery. So what are they guiding through the surgery? Or what are they talking about? So they are saying the tuohy needle is advanced towards the location in greater occipital nerve and lesser occipital. So TUOHY, tuohy needle or tuohy needle. You might know the better absolute technical term, but I'm just using it from the other side of it. Okay. So tuohy needle, TUOHYNEEDLA. Question 10. What type of motion should be minimized to decrease mechanical stress? So mechanical stress or leads prevent lead migration. So definitely they're asking you something. So it should be there in complication, isn't it? So what is a complication? What are they talking about? Is it talking about anything? Yes, it is talking. What is it saying? Avoiding excessive neck movement. A 3-word answer. 𝐸𝐶𝐸SIVENECK Clear? Now for question 11. What is the implantable device aiding to lead tunneling into the truncle? Now this is, I love that word. So I also had to do a lot of searching on the aspect. What is truncle? What is truncle? Then I found out it is to show what. Do you know what is truncle? Let me ask you first. Before. Any idea what is truncle? but you don't really have to, okay? Because as long as it is there. Anybody know what is truncle? So truncle means it is a place where, it is in buttocks, chest, lower abdomen and all are mentioned. So the answer is, it should be also there in B, isn't it? So the same plate 2 led, and they're talking about fluoroscopical guidance inserted, implanted into the buttocks, chest, lower abdomen. So what is the thing? Neurostimulator. NEUROSTIMULATOR. Device is not needed because the question is having device. Good. So among 3 patients experiencing delayed infection, what proportion underwent reimplantation of ONS? So 3 reimplantation. Do you really need? Out of 3. So where are they talking about? Out of the 3. Delayed infection. So delayed infection is there. So what is the 1? So how many? It is 1. Very good. So how many of them got the re-implementation? It's a very straight answer because the answer is 1. Why? It is not there. It is of 3 patient infection, 1 was re-implanted 10 months later. So the answer is 1. Now question 13. Where? Now there's definitely a place, isn't it? Where? The patient encountered neuropathic discomfort, manifestation of intractable headache disorder. So headache disorder where? Definitely go to A. So neuropathic pain where? Occipital region. 𝐿𝐶𝐖𝐵𝐼𝐶𝐴L What were the clinical statuses of 6 patients who discontinued prophylactic medication? So prophylactic medication discontinued. So definitely prophylactic is there in C as well as in D. Now let's see what were the stages. So prophylactic symptoms where they're talking about. So they're talking about. So out of that they're talking. It is there as chronic. So chronic CH. Remain chronic is not necessary. What were the condition? Chronic CH. Because they are already saying that, isn't it? So chronic CH is the answer. Now for the final stint of question, it's called fill in the blanks question where the instruction remains same. Word, number, both, short phrase. Here you have to be very cautious with redundancy. Do not write the word which is already there in the question. So in multiple investigations concerning, there is a documented occurrence of lead migration range between 8 to 10%, constituting a prevalent complication. So where are they talking about all these complications? Any doubt? Go to D. Now where are they talking about? So 8 to 10% straight there. So the variation stands in occipital neuralgia, PITALNEURALGIA. Question 16. Chronic headache typically characterized occurrence headache half or more 10 days each month, extended beyond the duration. So definitely a duration. So where are they talking about all these duration? I know that. Why? Fortnight, 2 weeks, more days, month, longer than 3 months. THREEMONTHS. Other measures suggested to forestall lead. So other measures recommended to prevent, forestall. I love this word again, forestall, prevent. Migration involved application of, so something is to be applied. So what are you going to apply? Where are you going to apply? It should be there again in D. What are you to apply? So you are to apply silicone glue. Okay? Because all the others are there in the question. Okay? Because pilable neck collar, there in the question, adopting midline procedural approach. So silicone glue is the only thing which is missing. SILICONEGLUE. Question 18. Once the lead is optimally situated using dash through the needle cautiously withdrawn and the lead is securely anchored in position. So something has to be done. Then you're gonna take it. So during procedure, most probably. So what are they saying? Permanent lead placement may be carried under general which lead the adequately positioned through the needle under Fluoroscopic guidance, FLUOROSCOPICGUIDNC. The needle is carefully removed and the head is fixed in place. That's it. Question 19. Within the group, group means go to C. Patient subject to prolonged observation as subject of dash individuals experience progression towards episodic CH. So episodic CH, how much? So what are they saying? The answer should be 10 and 4. Understood? So 10 and 4. Good enough. Within the group of 10, 4. Electrical signals transfers lead into position refined until the patient communicates distinctive sensation labeled as dash, enveloping the nerve tertiaries, enveloping, across, cover, all those things that can come. So where are they talking about? Again, go to B. Why? So electrical impulses and all those things, pins and needle sensation called paresthesia. Paresthesia. Very good. So I have wrapped my 20. It's high time that you start clarifying. If there is any doubts, please be kind enough to ask me. If not, do shoot me your total scores. Even though few mistakes here and there, but almost all have got it right. 17 out of 20, Soumya, excellent, good enough. Shakila Banu, 19, very, very good, excellent, keep it up. Neethu Soni, 15, good enough, keep it up, good. Preeta Paul, thank you. Pleasure is always mine. Rosmi George, 17, excellent, good enough. Softy, 18th question. 18th question is fluoroscopic guidance, 19 out of 20. Hina Softy, 17 out of 20, excellent, good enough. Good. Sony Raphael, 16 out of 20, good enough. See, the whole reason I love those students who have the ability to say whatever that score they have, because that's the part of learning. Because it's part and parcel. You have to say, okay, I got this. Now go back and see why you missed the others. And that's the power of learning. Shine Johnson, 18, excellent. Softy, thank you very much. Uttam Kumar, 16, 15 minutes, very good. Kavita Balaji, 14, good enough, keep it up. Bindu Raja, new name, 19, excellent, good enough, keep it up. Shakila, thank you, pleasure. So Sumi and Sumi and Shine, Sumi and Smitha, congratulations for your great achievement of today, and thank you for coming and letting us know that you've made to your dream. We're all happy. So Srimo, thank you. Anisha, 17, good enough. Rosmi, thank you. So as you've all started saying thank you so much for giving another lovely session with all of you. Uttam Kumar, thank you. Until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.